If you are over 60, diabetes may already be shaping your health in ways you don't see. Are your nails quietly warning you? Ignoring these signals could mean infections, amputations, or worse. Every year, more than 130,000 older adults in the United States lose part of a foot or leg because of diabetes-related complications, CDC, 2023. That number is heartbreaking. Behind every statistic is someone's father, someone's grandmother, someone who just wanted to enjoy retirement without constant hospital visits. Yet most people miss the warning signs until it's almost too late, when the pain is unbearable, when mobility is gone, when dignity slips away. Most people dismiss nail changes as simple aging or poor hygiene. But in reality, your circulation, nerves, and immune system are trying to raise a red flag. Those tiny cracks, those color shifts, those infections, they are the voice of your body calling for help. Today, we'll uncover 13 diabetes nail symptoms after 60 that you should never ignore. Some may surprise you, like brittle nails that break for no reason, or dark streaks that look harmless. By the end, you'll know exactly what to watch for, and when to see your doctor before it's too late. Let's dive into these life-saving warning signs. Symptom 1, thickened, brittle nails. Thick, brittle, yellow-tinged nails that split easily. They look dull, hard to trim, and sometimes curve downward at the edges. This happens because diabetes weakens tiny blood vessels. Less blood means less oxygen and nutrients reaching the nail bed. Without fuel, nails grow slower, thicker, and fragile. It's not cosmetic, it's a health warning. Compare it with normal aging nails. Yes, nails can get a bit slower after 60, but they don't usually turn abnormally thick or crack like this. In seniors with diabetes, the change is sharper, more stubborn, and tied to poor circulation. A 2023 study in Journal of Clinical Endocrinology and Metabolism found that older adults with type 2 diabetes had a 47% higher rate of brittle, thickened nails compared to healthy peers. That's almost half of every group studied. Over time, these nails can trap fungus, create pain with every step, and even lead to hidden infections under the nail plate. That infection can spread into the skin, the foot, and beyond if blood sugar remains uncontrolled. Early proof. When trimming nails, you may notice thick dust falling off, or the nail resisting the clipper. Sometimes a faint odor appears, long before obvious swelling or redness shows up. The mistake many seniors make is brushing it off as just old nails or blaming poor footwear. Dangerous thinking. Each crack is an open door for bacteria. If ignored, what started as a brittle nail could escalate into an ulcer that refuses to heal. Seniors with diabetes must see this for what it is, a signal not to overlook. Symptom 2, yellow or brown discoloration. A toenail turns yellowish or brown, sometimes with darker streaks running from the base to the tip. The surface may look waxy or uneven, and the color refuses to fade even after cleaning. This happens because high blood sugar weakens the immune system and slows circulation. Fungus takes advantage, thriving under the nail where it's warm and moist. For someone living with diabetes, this is more than cosmetic, it's a clear red flag of poor foot health. If you compare it with healthy nails after 60, normal nails may show mild ridges or a slightly dull tone, but they don't shift into a persistent brown or mustard color. In seniors with diabetes, the discoloration is stubborn, often spreading across several toes at once. A 2022 review in Diabetes and Metabolic Syndrome showed that fungal nail infections were nearly twice as common in patients over 60 with type 2 diabetes than in non-diabetic peers. That's not a coincidence, it's circulation, immunity, and glucose levels all working against the body. Over time, the nail thickens, lifts from the bed, and cracks at the edges. Small gaps form, perfect hiding spots for bacteria. That's how an infection in one nail can creep into the surrounding skin and trigger diabetic foot ulcers. Early evidence. A faint yellow hue at the cuticle line, or a single brown streak that keeps growing upward. Catching it here can save months of painful treatment. The mistake many older adults make is painting over it with polish or ignoring it until walking becomes painful. That's a trap. Covering it hides danger, and by the time pain arrives, the infection may already be deep. Seniors focused on health must treat this symptom as urgent, not cosmetic. Symptom 3, slow nail growth. The nails stop growing at their usual pace. Weeks go by, and the length barely changes. The edges look thin, pale, and sometimes flat. This is circulation talking. Diabetes damages the tiny vessels that feed the nail bed. Without steady blood flow, the nails don't get oxygen, nutrients, or protein needed to grow. It's a quiet, but powerful, marker of vascular decline. In healthy adults over 60, nails may grow a little slower, but they still keep a steady rhythm. In seniors with diabetes, growth can nearly stall. That difference matters. One is natural aging, the other signals compromised blood supply and tissue health. A 2023 study in Frontiers in Endocrinology confirmed that peripheral circulation in older adults with diabetes directly correlates with nail growth rate. Reduced flow equals slowed growth, an early predictor of foot complications. Left unchecked, this doesn't just mean short nails. Over time, reduced nail growth pairs with skin thinning and nerve damage. The foot becomes fragile, prone to ulcers, and wounds refuse to heal. Early proof shows up when nail clippings are tiny or non-existent after a month, or when one toe's nail grows far slower than the others. That's not coincidence, it's blood flow imbalance. The mistake many make is assuming short nails are good nails because they don't need trimming. Wrong. It's a vascular warning. By the time pain, numbness, or color changes appear, tissue damage may already be underway. Seniors after 60 should see slow nail growth as a direct call to check circulation and diabetes control. Symptom 4, recurring fungal infections. The same nail keeps getting infected. It clears up with cream or pills, but weeks later the yellow, crumbly look returns. Sometimes multiple nails are involved, each one fragile and painful to touch. Here's why: diabetes weakens immune defenses and alters skin chemistry. High sugar in tissues is like fuel for fungus. Once it takes hold under the nail, poor circulation makes it harder to fight back. What looks like a minor issue is, in truth, a persistent battle your body is losing. For someone in good health, a single fungal infection may come and go. But in seniors with diabetes, the recurrence is relentless. After 60, each cycle grows harder to treat, and the nail bed can become permanently damaged. A 2022 study in Mycoses Journal showed recurrence rates of nail fungus in people with type 2 diabetes were more than 60% higher compared to non-diabetic peers. That means most treatments fail unless blood sugar is also brought under control. Over time, repeated infections thicken the nail, distort its shape, and press into nearby skin. Small cracks invite bacteria, setting the stage for ulcers or cellulitis. The earliest proof: itching at the cuticle, flaky debris under the nail, or a musty smell even before thickening becomes visible. The common mistake is self-treating with over-the-counter creams again and again, hoping it will go away. Dangerous move. Without addressing blood sugar and circulation, every relapse is more severe than the last. Seniors focused on long-term health must treat recurring nail fungus as a systemic warning, not a cosmetic flaw. Symptom 5, dark streaks or lines. Thin brown or black lines running lengthwise through the nail. Sometimes just one stripe, sometimes several, starting near the cuticle and extending outward. They don't wash off, they grow with the nail. What's happening? In diabetes, fragile capillaries under the nail bed can bleed or leak pigment. Circulation is compromised, and sugar-damaged vessels leave behind these streaks. It's not just a bruise unless there's a clear injury. Compare it with a healthy nail after 60. Normal nails may show faint ridges, but they don't develop stubborn dark lines without trauma. In seniors living with diabetes, these streaks often appear out of nowhere, with no bump or accident to explain them. A 2023 paper in Journal of the American Academy of Dermatology reported that longitudinal streaks in older diabetic adults were linked to a 2.5-fold increase in peripheral vascular disease. That's blood vessel damage showing up before major symptoms. Over time, these lines can widen, merge, and darken. If ignored, they may signal deeper microvascular disease, precisely the process that leads to neuropathy, kidney strain, and vision loss. Early proof is subtle, a faint pencil-thin mark at the nail base. Many brush it off until it thickens or multiplies. The mistake. Seniors often blame these streaks on old age or think it's leftover dirt. Dangerous assumption. A dark line under the nail is the body's SOS. Ignoring it risks missing a window to detect circulation trouble early, when intervention is still possible. Symptom 6. Ingrown toenails. The nail edge curves inward, slicing into the skin at the side of the toe. Swelling, redness, and tenderness soon follow. Sometimes a small pocket of pus appears. For seniors, every step feels like walking on glass. Why does this happen? In diabetes, nails often grow thick and distorted from poor circulation and nerve damage. Combine that with shoes that squeeze the toes, and the nail starts digging into the flesh. The body's defenses are already weaker, so a minor cut becomes a breeding ground for infection. In someone with good health, an ingrown toenail is painful but usually heals with proper care. For seniors with diabetes, especially after 60, it's far riskier. Poor blood flow slows healing, while nerve damage masks pain until the infection spreads. A 2022 study in diabetic foot and ankle found ingrown toenails were one of the leading triggers for foot ulcers in older diabetic patients. Once an ulcer forms, the chance of needing hospitalization or even amputation rises sharply. The progression is predictable: first a tender spot, then chronic swelling, then an open sore that refuses to heal. By the time the nail looks deformed, the surrounding tissue may already be breaking down. The earliest proof. Redness right at the nail corner, or a toe that stays sore even after trimming. The mistake most seniors make is cutting the nail too deep at the corners or ignoring the pain until shoes can't be worn. That's not just uncomfortable, it's dangerous. One careless trim can open the door to a cascade of complications no senior should ever face. Symptom 7. Clubbing nails. The nails curve downward, wrapping over the fingertip like a rounded dome. The tips look swollen, the angle between nail and skin disappears, and the surface feels spongy when pressed. Why does this matter? Clubbing is a classic sign of oxygen deprivation. In diabetes, damaged blood vessels and reduced circulation mean less oxygen reaches the extremities. The body responds by altering nail growth, thickening tissue under the nail. Compare it with healthy nails in older adults. After 60, nails might get ridges or mild discoloration, but they don't develop that bulbous, rounded shape unless something serious is going on. For seniors with diabetes, it's often linked to long-standing vascular or even cardiac strain. A 2023 study in vascular health and risk management confirmed that digital clubbing in diabetic patients correlated strongly with chronic peripheral arterial disease. It's not just cosmetic, it's a systemic marker of declining vascular health. Over time, the curvature deepens. The nails start resembling watch glass shapes, and fingertips feel thicker. This isn't sudden, it creeps in over months or years, silently pointing to oxygen and circulation problems. Early evidence. A subtle change in the nail angle, where it no longer forms a neat 160-degree line but flattens, then bends downward. The mistake seniors make is assuming it's harmless, thick nails from aging. Wrong. Clubbing nails are never just about age. For someone with diabetes, they scream out that the heart, lungs, or circulation are struggling. Ignoring them risks missing a chance to catch life-threatening complications early. Symptom 8. White spots or streaks. Tiny white dots or faint streaks appear across the nail surface. They may start near the cuticle or scatter randomly, often mistaken for old injury marks. Unlike trauma spots that fade with growth, these linger or multiply. Here's why: in diabetes, poor absorption of nutrients, especially zinc and protein, weakens nail keratin. Blood sugar swings also damage microcirculation, disrupting delivery of minerals to the nail bed. The result? Nails marked with pale spots, a hidden message about metabolic imbalance. Compare it with normal aging after 60. Seniors in good health may see occasional white specks from bumping a nail, but those grow out quickly. In seniors with diabetes, the spots recur, spread, and often show on multiple nails at once. A 2022 clinical study in nutrients found that adults with type 2 diabetes were nearly twice as likely to show chronic leukonychia, white nail changes, linked to micronutrient deficiencies. That connection was strongest in older patients. Left unchecked, these nails don't just stay speckled. Over time, the streaks widen, nails thin, and break more easily, raising infection risks. Early proof. A single white line that doesn't move as the nail grows, or new spots appearing every few weeks. The mistake many over 60 make is blaming calcium loss or dismissing it as cosmetic. Dangerous assumption. These spots are not just age. They're the nail bed's early SOS, signaling nutrient depletion and impaired metabolic health in seniors living with diabetes. Symptom 9, redness or swelling around nail beds. The skin around the nail base looks inflamed. Red, puffy, tender to touch. Sometimes warm, sometimes with a shiny stretch as if fluid is trapped under the skin. Here's what's happening: diabetes impairs immune defense and slows microcirculation. Even a small cut from trimming or tight shoes lets bacteria slip in. With glucose feeding the infection, redness and swelling appear fast. What seems minor can quickly spread. Compare this with healthy adults after 60. A small nick might cause mild redness that fades in days. But in seniors with diabetes, the inflammation lingers, worsens, and often turns into chronic paronychia, nail fold infection that refuses to heal. A 2023 study in clinical diabetes and endocrinology found that older adults with uncontrolled diabetes had a threefold higher risk of persistent nail fold infections compared to non-diabetic peers. That swelling wasn't cosmetic, it was the earliest signal of tissue vulnerability. Over time, redness becomes pain, then abscess, then a draining wound. Each step is harder to reverse, especially when circulation is already compromised. Early proof. A faint blush at the cuticle line, soreness when pressing the toe into a shoe, or swelling that doesn't match the injury. The mistake many seniors make is soaking the toe in hot water and waiting, thinking it will calm down. But with diabetes, waiting feeds the infection. By the time pus forms, the risk of ulceration or systemic spread is real. For seniors focused on health, ignoring red, swollen nail beds is playing with fire. Symptom 10, pitting nails. Tiny dents scatter across the nail surface, like the nail was tapped with a pin. They may be shallow or deep, random or lined up, making the nail rough and uneven. Why it matters: in diabetes, immune dysfunction and chronic inflammation affect skin and keratin production. The same processes that dry skin or trigger rashes can also disrupt nail growth, leaving pits as evidence of systemic stress. Compare this with normal nails in healthy seniors. After 60, nails may ridge or thicken slightly, but they remain smooth on top. Pitting is different. It signals inflammatory change, often linked to psoriasis, eczema, or immune imbalance worsened by unstable blood sugar. A 2022 analysis in Journal of Dermatological Treatment highlighted that adults with type 2 diabetes had a significantly higher rate of psoriatic nail pitting compared with the non-diabetic population, pointing to overlapping inflammatory pathways. Over time, these pits deepen, merge, and distort the nail plate. The nail may split, peel, or detach from the bed, creating painful gaps vulnerable to fungal or bacterial invasion. Early evidence. 1 or 2 tiny dimples on the thumbnail or big toenail, hardly noticeable, but they stay as the nail grows, instead of moving outward like trauma marks. The mistake many seniors make is buffing the surface smooth or covering with polish, dismissing it as just ugly nails. That hides danger. Pitting nails in someone with diabetes are not cosmetic, they're the body's inflammatory fingerprint, a warning that the immune system and skin health are under strain. Symptom 11, dry, peeling cuticles. The skin around the nail base turns rough, flaky, and peels in thin strips. Sometimes it cracks, leaving painful edges that sting with every touch. Here's why: chronic high blood sugar dehydrates tissues. Diabetes pulls fluid out through increased urination, leaving the skin dry and fragile. Circulation decline reduces the delivery of oils and nutrients that keep cuticles supple. The result? Cuticles that shred instead of sealing the nail bed. Compare this with normal skin changes in healthy seniors. After 60, cuticles may thin, but they usually stay intact with basic moisturizing. In seniors with diabetes, the cuticles split repeatedly, no matter how much lotion is applied. A 2023 report in Journal of Clinical Diabetes Care found that older adults with uncontrolled diabetes were twice as likely to develop recurrent cuticle peeling and infections compared to age-matched controls. It's a small detail with a big story behind it. Over time, those tiny cracks become open doors for bacteria and yeast. One small tear can evolve into paronychia, then into a stubborn infection that spreads to the nail and skin. Early evidence: a faint white rim at the cuticle, followed by flakes lifting off after washing hands. Seniors often see this weeks before redness or swelling appears. The mistake many make is pulling or trimming the peeling cuticle themselves. That action deepens the wound and sets the stage for infection. For seniors managing diabetes, dry, peeling cuticles aren't just an annoyance, they are early alarms of dehydration and immune stress that demand attention. Symptom 12, black toenails, subungual hematoma. A dark patch spreads under the nail, brown, purple, or black. Sometimes it looks like a bruise, sometimes like dried blood trapped beneath the nail. It doesn't fade with washing, and it grows downward with the nail plate. Here's why it matters: in diabetes, fragile vessels in the toe break easily. Even small pressure from walking in tight shoes can cause bleeding under the nail. Poor circulation slows healing, while high glucose fuels tissue damage. The nail darkens, but underneath, the skin may already be suffering from reduced oxygen. Compare it with a healthy senior. After 60, a black toenail usually comes from a clear trauma, a stubbed toe, a long hike. It grows out in weeks. In seniors living with diabetes, black nails can appear with no memory of injury and may linger for months. A 2022 study in diabetic foot and ankle reported that unexplained subungual hematomas in diabetic patients were strongly linked to peripheral arterial disease, a precursor to ulcers and amputations. Progression is silent. The dark patch thickens, nail edges lift, and infection can sneak underneath. What began as a bruise can end as an ulcer hidden beneath the nail plate. Early proof: a thin, linear streak turning dark, or a small black dot that spreads instead of shrinking. The mistake many make is dismissing it as just a bruise. Dangerous thought. In diabetes, black toenails aren't always trauma, they can be early vascular warnings, and ignoring them risks delayed diagnosis of serious circulation problems. Symptom 13, non-healing wounds near nails. A small cut from trimming, a blister from tight shoes, or a scrape near the nail edge. Days pass, weeks pass, yet the wound refuses to close. Instead of scabbing and healing, it stays raw, sometimes oozing, sometimes turning red around the edges. Here's why: diabetes damages both circulation and nerve supply. Blood flow can't deliver enough oxygen and nutrients to repair the tissue, while neuropathy dulls pain signals. The body doesn't feel the injury, so it doesn't heal it efficiently. Sugar in the tissue feeds bacteria, making even the tiniest wound risky. Compare this with someone in good health after 60. A nail nick may sting, but it heals in days. For seniors with diabetes, the same nick lingers, worsens, and may even become a chronic ulcer. A 2023 study in Journal of Diabetes Research showed that non-healing periungual, around the nail, wounds in older diabetic patients predicted a fourfold increase in risk of foot ulcers within 1 year. Over time, these wounds deepen. Skin breaks down, infection spreads, and in severe cases, bone underneath becomes exposed. That's when amputation risk rises sharply. Early proof. A minor cut that looks the same after a week, or a scab that keeps reopening every time shoes rub against it. The mistake seniors make is thinking, it's small, it'll heal. That delay is dangerous. In diabetes, a non-healing wound near the nail is not minor, it's one of the most urgent red flags for overall foot health. You might be wondering now, what should I actually do if I notice any of these nail changes? The good news is, there are simple, science-backed steps you can take today. First, daily inspection is non-negotiable. Check your toenails and the skin around them every night, especially if you are over 60. A mirror on the floor or a loved one's help can make sure nothing is missed. Second, foot hygiene is your frontline defense. Wash with mild soap, dry thoroughly, and keep nails trimmed straight across. Never dig into corners, this prevents ingrown nails. Moisturize the cuticles, but skip lotions between the toes to avoid fungus. Third, protect circulation. Choose shoes that fit properly, socks that breathe, and move your feet daily. Simple ankle rotations or short walks can improve blood flow. Research in Diabetes Care, 2023, showed that seniors with type 2 diabetes who performed daily foot care had a 40% lower risk of ulcer development. Fourth, act early. At the very first sign of infection, redness, or a wound that won't heal, call your doctor or podiatrist. Don't wait until pain forces you. Early intervention saves toes, feet, and lives. Finally, remember, controlling blood sugar is the master key. Without it, no cream, no clipper, no shoe can protect your nails. With it, healing improves, infections shrink, and your health outlook brightens. So, when you see your nails change, don't panic, but don't ignore. These are not cosmetic flaws. They are signals. Signals that you, as a senior living with diabetes, can use to take back control of your health. Your nails tell the truth, small changes that reveal big risks. After 60, ignoring them can cost not just comfort, but mobility, independence, even life itself. But when you pay attention, you gain power, the power to catch problems early, protect your feet, and protect your health. If this video opened your eyes, share it with a friend who may need it. Leave your questions in the comments, I read every one. And don't forget to subscribe for more life-saving tips on diabetes care. Now, continue with our playlist for deeper guidance tailored to seniors.